Okay, so hi guys. Posting another video in one day. 2 videos in one day. This little chunk would not let me sit down to record unless she was being held, so you guys get to see one of the little babies. And my dog's gonna start now. But as I mentioned in my previous video, these two, especially this one, this is baby B. She had a lot of problems in utero and a lot more problems after in the NICU. I'm going to try to cover all of that today. I am sorry about my dog barking. She does not shut up. She's currently mad at me because I won't let her zoom around the house and tear stuff up. But I got scans, I have letters, I have other keepsake stuff from the NICU and all that. She's still sick. She doesn't feel too good. But this is Bruna. This is our tiny little baby bee. She was the itty bitty one, weighing at exactly 2 pounds at birth. Yeah. She's antsy. If you see this under their onesies, that is their G-tubes. They eat by mouth and through their G-tube. They have swallowing difficulties, which it took the NICU a little bit to find that out, but luckily they got that solved and we're doing better. But I'm gonna try to do this one-handed. As I mentioned in a previous video, we didn't see baby B until a little bit after. As you can see, there's only one baby there. Only one. But then when she moved the probe around a little bit, you can see baby B down there in the little, whatever you'd call that part of my uterus. And then when she did the transvaginal, that's when we can clearly see both babies. But as you can see, baby B was not facing how baby A was. You can see the outline of her, and then for baby B, you see her, but she's in a different position. As stated previously, on June 8th of 2020, that's when I found out that I was having identical twins. She's so cranky, baby lady. What's wrong, honey? Now, the first trimester of mine was pretty bad. I was vomiting, throwing up all the time. I could not keep anything down until maybe like the middle of my second trimester. And that's when I was able to fully eat meals and keep stuff down. Now on 9/14/2020 is when I found out that I was having identical twin girls. Now, little bit of backstory here. Baby B did not like to be seen at all on scans when we got closer to the second trimester. This is baby A before we found out what she was. And then we found out they were girls. That's baby A. And then when you flip my ultrasound over, you can clearly see that it says, it's a girl. Me and my fiance were a bit shocked by the fact that I was having girls, because a lot of people thought I was having boys. But we're very happy that we got my cutie patooties. Now this is the scan where we started to realize that something was going on with baby B. Here is baby B. She was facing down most of the time in my hips. Honey. And that's when the ultrasound tech started to look at fluids between the girls and noticed that baby B didn't have a lot. And she was always cramped in my uterus. Always cramped. And then from that point on, I was sent to a specialist through St. Vincent, family and maternal medicine for high-risk pregnancies and diagnosis and stuff like that. He wasn't quite comfortable to tell me whether or not it was because of the condition twin transfusion syndrome. If you don't know what that is unequal sharing of fluid and nutrients through the umbilical cords between babies. This was my first scan with him. Again, baby B did not want to be seen. She's right here. With the amount of low fluid that she had, it was really hard to see her on scans. And then here's baby A. You can clearly see her. She was the spotlight baby. She loved to be seen. Always. I had these laminated so I wouldn't mess them up. And so they can have them when they get older. And from that point on, I was sent to Cincinnati Children's, as I mentioned previously. I don't believe this was the very first scan that I had. Actually, I think it was. But here is baby B. They checked their hearts, their fluids, their body lengths, their head circumference, all of that. And they immediately noticed that both babies were very small in diameter. And this was at 23 weeks and 5 days. Now, close to one of the last scans that I had before I was admitted for surgery, for the fetoscopic, this was my baby. This was my, actually no, that was close to the last one. This was the last scan that I had before having the fetal surgery. This was the first one. We did not even see baby B. We only saw baby A. And here's her foot. And then on this back, you can see her little feet. Now, this is where the story kind of gets a bit sad. Because I was told that I wasn't meeting the criteria for twin, and that the likelihood of me needing surgery was really rare. That I shouldn't progress into it, but if I did, then I would be a candidate for that. However, this is really hard to talk about. I was put on blood pressure medication for hypertension, which is high blood pressure. I didn't have preeclampsia during my pregnancy. I actually suffered from quite low blood pressure when I was pregnant with them, and I still do. My blood pressure is always low to this day. But they put me on this thing called Precardia. And the reason why they did that was because of baby A's heart. She had an extremely high heart rate because of the amount of increased fluid that she had compared to this little junk right here. The Precardia was supposed to pass through my placenta and basically lessen the amount of blood flow that she would get, to where her heart rate wouldn't be so high that she would go into the dangers of heart failure, and we risk losing her in the womb. Wiggle butt. But basically, I was put on that for like a week until my next scan. Hi. You just want to see mommy? Yeah. And then after I was put on that, when we had the next scan at Cincinnati Children's, we noticed that I had an MRI that morning. I had an MRI at 7 something in the morning. And that's when they noticed that my cervix was shortening during the MRI. I didn't have any signs of cramping. I didn't have any signs of cramping or bleeding, so I had no idea that my cervix had shortened because of small contractions. From that point on, they put me in a wheelchair, and I wasn't allowed to walk to any of my other appointments that day. I had another echo for their heart. And I had a nurse visit to check vitals on me and stuff like that. They pushed all my appointments up. So after I had the fetal MRI, I went in for the ultrasound, where they would measure fluid, check heart rates, growth, and all of that. Close to around the end of my appointments with my echo, they rushed that, and then the team meeting where all the doctors and us collaborate and talk about what we found, they moved that up too. So right after the echo, I was supposed to have like half an hour wait time, and then I go for that. No, after the echo, they rushed me into the team meeting, and actually no, I'm missing a part. After the echo, the doctor that was watching closely throughout the day with my tests and imaging and stuff, she wanted to conduct an ultrasound herself so she could see what was happening. And in that scan, she found out that both her umbilical cord was hypercoiled, meaning it was kinked. She had fluid buildup on her head. Her kidneys were not present in the scan. And they basically told me that both of my twins were dying. Like, in that moment, I was told that my twins were dying. I broke down in tears. So did my fiance. We were devastated because just a few weeks, like not even just a week, just a week ago, we were told that they were doing okay for what the condition could possibly be. And in the team meeting, they concluded that I needed the fetoscopic surgery, or I could terminate, or I could go ahead and have them delivered. And at this point, we were only 23 weeks. They had 0 chance of survival at that point. Like, they showed me pictures of preterm babies and how that looks to give birth to babies that premature at that gestational age. The likelihood of me staying pregnant was actually not even thought of at that point. Like, they were either surgery or delivery or terminate. Naturally, me and my fiance decided to do the surgery. So I was evaluated for it. They gave me everything I needed. And then I was admitted to the hospital. When I got to Good Samaritan Hospital, I was given a steroid shot and a pessary. The pessary is basically like a donut that goes up your vaginal canal and helps keep your cervix shut, because these two were pushing down into my hips because they were wanting to escape. And from that point, I had surgery first thing in the morning, 8 a.m. We got it ready. And then basically they were unsuccessful at separating their placenta. So at this point, there's no treatment for the possible TTTS that I had. There is a form of hydrops, TAPS, and TTTS that I was diagnosed with these two. Baby B was showing signs of hydrops and TAPS. TAPS is, I can't remember the correct term of it, but hydropic meaning no bladder, no kidneys. She wasn't producing fluid. So I stayed there for maybe like a week. And then a few days later, actually I should probably talk about the medication that I was on. I was given progesterone that you don't take orally, you put it up your hoo-ha, to strengthen my cervix for the possibility of me to be able to deliver closer to term. Yeah. Are you trying to poop? I think she's trying to poop. But, Miss Lady. And I was on the steroid shots to strengthen their brain and lung capacity. One of the scans that I had first thing in the morning, I think it was on like day 4 of me being there, they noticed that baby B, this little princess right here, she was very anemic. And they basically told me that if I was not rushed into surgery for her, she would pass within the next 24 hours. So I was prepped for surgery. They had everything in there for both babies to be delivered because there was a high chance of my amniotic sac rupturing completely and them having to deliver them immediately so they wouldn't struggle and I wouldn't get an infection from my amniotic fluid breaking and them still being in there. So after that surgery, I was still in there for a little bit. I was moved to a different ward. It's a high-risk unit at Good Samaritan Hospital. I did not like it there. I was so alone. I felt like nothing was going to go right. And I talked to one of the doctors and I said, can I please have the forms to discharge myself? Now, I do not condone this. Don't do this. If you have no other options, do not go against medical advice because you honestly do not know what would happen. I had no idea what would happen. But I basically told them I would like to be transferred down to the doctor that I was first seeing for this problem for the second opinion from my original OB. And at first they were not okay with it, but I pulled some strings. I got an appointment ready for the day after me coming home, and I was able to come home still pregnant. I was on bed rest. I had to take heparin. I had to take Bayer aspirin. I had to take Precardia, my prenatals. And I'm pretty sure that was it. Now from this point, I was monitored every week for the month of October. Every single week. Now this is where it gets fun. The last scan that I had, she was actually showing signs of fluid improvement. She didn't have a lot, but she was looking good. And then October 29th of 2020, I went to bed and I woke up in a pile of what I thought to be my pee. I thought I peed myself in my sleep. I stood up and it trickled down my leg. I went to actually go pee. Realized it was not my pee. It was my water. I did not tell my fiance. I went back to bed. I didn't wake up with it, but I did leak every time I moved. Now, I didn't get to the hospital until around 9 a.m. that night. And they did a test to see whether or not my water did break, and they said that they can't determine whether or not my fluid did break. So they treated me for ruptured membranes. I was on antibiotics. They gave me another steroid shot to improve this baby's brains and lungs. And they also did magnesium to slow down the labor. Now, the first night I was there, I wasn't actively laboring, but baby A's heart rate kept dropping, and they woke me up at like 12 that night on October 30th that they may deliver. Luckily, they did not deliver, and I was able to stay pregnant for at least 2 to 3 days. Now, the rest of my time in the hospital at that point, normal, ultrasound, meds, until October 31st, I started having contractions, really bad ones. They started at nighttime, shortly after I ate, and I told my nurse. She said that it's probably nothing. She didn't even hook me up to the monitor. She just gave me Tylenol and Advil. Now, the hospital I was at was St. Vincent's Women's Hospital in Indianapolis. They're known for their NICU and their birthing center. They basically specialize in women and maternity stuff. I was contracting. They gave me Tylenol, the ice pack. Fine, I went to sleep. Next morning, I didn't have any until after I ate. Actually, no, I didn't get to eat yet. I had just ordered my food when I started having it more. And the nurse that was on shift that day, I told her, and they kept getting increasingly painful. So she hooked me up to the monitor, but unfortunately, you could not tell that I was having contractions. Now, from that point, she gave me this button to push every time I felt one. And every time I get one, I'd push. And maybe within 10 to 15 minutes after she gave me that button, she came rushing in. The doctor came rushing in, and they're like, all right, we're going to see if you're dilated. They took the pessary out. I was only 3 centimeters dilated. They said, we're gonna wait a little bit and see what happens. They go back out, maybe half an hour later. They come rushing back in, check to see if I was dilated. I had already dilated more. And then they also noticed that baby A's heart rate was dropping with each contraction as I monitored it. So I was prepped and ready for my emergency C-section on November 2nd of 2020. My fiance had to go down to the car, so whenever I found out that I was going in for surgery, I quickly called him. I was like, hey, you gotta get upstairs. We're about to have the girls. So I get ready. I go into the OR. I'm all prepped. I'm ready. He finally comes in. Now, I know that you're not supposed to feel pain when you have a C-section, but however, I felt as if I was actually being ripped, like torn. You can feel the sensation of pushing and pulling. That's what got me. But it also felt like I could feel them cutting into me. Mind you, I had a spinal, and I told them that I still feel something, so they gave me fentanyl. It was so traumatizing to me because I'm actually kind of tiny, and they're just pulling me, pushing me, shoving me, and my fiance had to step out briefly because once they delivered the girls, they held my uterus up before putting it back in. I don't know why they did that. They did not explain that to me. But my fiance said that when the girls were lifted up out of me, they were put in these bags to protect them because of how prematurely they were because their skin and their body temperature, since they weren't able to regulate their body temperature at all yet. And they were shipped off to the NICU. All fine dandy. Cool. I just delivered my girls. I was extremely happy. My recovery wasn't the greatest. But I was in the hospital for about 2 to 3 days after I had them. My incision, from what my doctor said, seemed to be healing pretty nicely, and I was able to go home. Now, on the ride home, I got dizzy. My heart started to do this murmur, and that night I realized that I was getting sick. I did not have a thermometer, so I had no idea that I was running a fever. So I had to wait till the next day. Still didn't get a freaking thermometer. Or did I? Yeah, I did. My mom ended up getting me one, and I checked my temp, and it was 101. I called my doctor. He said to come in, so I went in for that. I get there, they check over me, and you could feel the heat radiating off of my incision. This is really hard, if you haven't noticed. But anyway, I was admitted. I was treated for an infection of my incision. I was not able to see the girls for 3 days, even though I was still in the hospital, to get the treatment that I needed for my C-section because of my fever. They had to wait for my COVID results to come back. And now, on the last day of me before going home, they gave me this antibiotic called Bactrim. It's a powerful antibiotic. My incision had opened up to a hole that was draining out fluid. I was given that as the final dose of my treatment. But that night, I started to have a panic attack after taking it. I got super dizzy. I felt like there was waves going throughout my body. And I was panicking because nobody was there with me. And I would explain it to the nurses. They said, eat something, drink water. They checked my blood sugar. Nothing helped. And it went all the way into morning. But before I went to bed, I asked for something to put me to sleep. Because there's no way I was going to sleep with how I was feeling. And that is what started my anxiety issue for postpartum. But, onto my incision. I had a hole about this big that I had to pack with gauze. It was extremely deep. It hurt like hell. And I had to deal with that for weeks after. Hold on, I'm gonna go fix Miss Lady. On to what I was saying. I had an incision about this big that a pack of gauze. It irked the heck out of me. But I was sent home with cephalexin because I switched my antibiotics. I was not going to take whatever else that they wanted to prescribe me because I told them that it messed me up. It got rid of the infection, yes, but it messed me up. So I go home, my anxiety's at bay. I feel okay for the most part. But then I noticed that I would wake up with immense fear. I would have panic attacks out of nowhere. I couldn't even be in the car. I would start freaking out. I was on the way to the NICU one night. This is before my birthday, my 21st birthday. My hands began to go numb and they were cinching like this and wanting to curl in on each other. And I felt tingles all the way up through my neck into my head. I freaked out so bad I went to the hospital. That was there's a main hospital and then there's a hospital for the pregnant ladies. I went there, went to the ER. They basically told me that I have a severe anxiety issue and they gave me Ativan for my panic attacks. Now, I did not seek help for my anxiety until December 16th of 2020. I suffered for nearly 4 weeks because I did not think that I would need it. I truly did not think that I would need medication to feel okay. Boy, was I wrong. So I was put on Lexapro. That has helped me tremendously. I still struggle from time to time, but it's nowhere near how bad it was. Now to talk about the NICU part, it was very sad, and I need to fix the ladies again. Excuse me. Alright, I'm back. I feel like I'm talking way too fast, but I gotta get used to this, so. As I was saying, I was put on Lexapro. Best decision I have made so far. Now on to the NICU part. The girls were born November 2nd, 2020. Autumn weighed 2.6 pounds and Bruna weighed 2 pounds even. Autumn was put on a ventilator and Bruna had CPAP. The reason why Autumn had a ventilator is because her lungs were not expanding as they should have. Both girls had an issue with jaundice. Luckily, their levels were not too high. Bruna had really bad kidney issues. She had a kidney infection. I was never quite told exactly what it was that she had, but she was on antibiotics for it for a while. And all that good stuff. We did have one scare where she would start breathing fast and it was hard for her to eat. Like, they tried bottle feeding them shortly after. I think they were about 35 weeks by the time that they started to bottle feed. Now, with her swallowing difficulties, they started Autumn out on this oatmeal consistency since she couldn't swallow properly because they both aspirated with their swallow study. Now, the oatmeal consistency was way too thick for Autumn. So once they learned that they did not put Bruna on oatmeal thicken, they put her on honey thick, and now Autumn's also on honey thick. I mean, I'd say overall the NICU journey was definitely very sad for me because I wanted them home really bad. But luckily, I have goodies that I would like to share with you guys about their stay and all that good stuff. And I gotta fix Miss Lady again. My stepmom had gotten me these memory boxes. One of them has an elephant and this other one has baby's first year on it. She couldn't find 2 elephant ones. I'm obsessed with elephants, so she was really trying hard. But I got keepsakes down here in both boxes for the ladies. Be right back. So clearly the girls were in the NICU for Christmas, for the very first Christmas. I got a few ornaments from them. Here's the logo for the hospital, Ascension St. Vincent. Now, I have my opinion on them. I'm not going to talk about that. We're going to be positive here. Here's another Christmas ornament that I was given. It says baby's first Christmas. This is the part that made me cry the most when I first noticed how small they were. This was their diaper. This was their itty bitty diaper. P2. And then this was one of their blood pressure cuffs that they had. This is a size 2. And by the time that they were sent home, they had a size 3 on their little legs. These are called Lovies. I would wear them in my bra with my scent, and then I'd leave them at the hospital for them. Some of them made it to them, and then they didn't make it back to me, but these are the ones that I did keep. These are the little shades that they had when they were going under phototherapy. Be right back. This is their first little hat. They had such a tiny little head. Their leads to their monitors. The first ones that they had were heart-shaped. And then these are the ones that they came home. Well, I got to take off of them when they came home. They were discharged from the NICU February 23rd of 2021. Happiest day of my life. My fall risk bracelet. A visitor's bracelet from one of the times when I visit them. Oh, this is for Thanksgiving, when I visited them on Thanksgiving. I have my positive pregnancy test for them to look at. And then in the other box, hold on. In the elephant box, I have, this is baby B's birth bracelet. Go. And then this was the beanie that me and my fiance picked out for the pregnancy announcement. We went with somewhat of a gender neutral color, but they obviously didn't get to wear it. And then there's more keepsake stuff in here. The bottom, this is the diaper that they were with once they got a little bit bigger in the NICU. They went from P2 to P1. Here's the other baby's Christmas ornament. Their footprints. There's Bruna's, and then here's another one of Bruna's. And then I have Autumn's in my wallet because I haven't put it in here yet. And then here's more bracelets that I had from being admitted into the hospital multiple times. I have a lot. But yeah. There's a lot more that I want to show that I'm going to try to quickly get into because this video is going to be like an hour long by the time I'm done. But now, I did mention that I had letters that I was writing to them when I found out that I was potentially losing them. I have not read them since. I'm only going to read a couple. Some of them I did not date. The earliest one that I have is from 10/12/2020. Autumn and Bruna. My last letter that I don't really remember all of what we talked about, but that's the joys of pregnancy. Pregnancy brain is real. I forget the smallest things very quickly, or I'll remember the least important details of something. Your siblings have been here with me and your daddy since last Thursday. They're stepbrothers and sisters. But the doctors told me that I need to take it easy since I'm still pregnant with you and your sister. I'm now 26 weeks and 4 days pregnant. As each week goes on, it's another week closer to meeting you two. The doctors are not entirely sure when I will deliver you two, but we are striving for 28 weeks and a few days is the goal, because you and your sissy are better developed and more likely to survive outside my womb. I was hospitalized not that long ago. Your dad and I went to what we thought would be a normal appointment at Cincinnati Children's Hospital to check on you guys, and it's to see if your condition had worsened. I had an MRI early on 9/28/2020. It was during the MRI that they noticed my cervix had shortened and I was having contractions, which I never felt any of the contractions. The MRI tech told me that I wasn't allowed to walk to the rest of the day, walk to the rest of my appointments. So your dad had to wheel me around in a wheelchair to the rest of my appointments that day. The week prior to that day, the news we received on YouTube was a lot more reassuring Therefore, we didn't think we had anything to worry about. But then everything started to escalate. We had another ultrasound, echocardiogram, and team meeting with all the doctors. They were so concerned about my short cervix and contractions that they moved all my appointments up. By the time we had our team meeting, one of my doctors wanted to perform another ultrasound to see for herself what was going on, which really confused me and your dad. She's never done that before. 5 minutes passed, and that's when we received more upsetting news. The way Dr. Hoffman explained to us is that Autumn was expected to pass at any time, and that Bruna would soon pass too. They had the nurse coordinator, a specialist neonatologist who specializes in very sick babies who have been born preterm. Your dad and I was given some pretty tough options on how to go about U2's plan of care. We could either let nature take its course and let Autumn pass and let Bruna pass. They deliver U2 despite the fact that you guys are not strong enough to live outside my womb yet, or do laser surgery to disconnect the blood vessels between you two and separate the placenta so you two wouldn't share nutrients anymore. Autumn was stealing a lot from Bruna, and honestly what you two were diagnosed with was very complex. It was twin-twin transfusion syndrome. Then later that week, we also received the news that Bruna was very anemic. Now we are dealing with twin-twin, but also TAPS. There's a lot more questions we have that still go unanswered. My doctors tried getting answers from other doctors, and you and Sissy are a rare pregnancy case. Back onto topic, we chose surgery to help with twin-twin, and they scheduled the procedure for that night, but me and your dad wanted to go home first so we could prepare for the surgery. Before I could go home, I had to check my contractions and do a COVID test. My contractions was not consistent, but I did test positive for COVID. And with all that, I was placed at Good Samaritan Hospital in Ohio until the next morning for the procedure. Or so that's what me and your dad thought. We were very angry and confused as to why everything had to happen so fast, and by those thoughts will always be with me and your dad. We still have a lot longer to go, and I'll explain everything as the week goes on. I was used as a lab rat. Love, Mom and Dad. Now, I kind of want to read this one. This is already 44 minutes long, but I will do my best. This is from 10/13. Wait. Yeah, that was the day after that. Autumn and Bruna. The third installment of you and Sis's journey is a long one, and I may accidentally repeat myself a couple of times. We left off when my doctor wanted to do an ultrasound to look for herself, which led to a team meeting where more of the news your daddy and I received was good. Well, none of the news were good. I was hospitalized at the Good Samaritan Hospital in Ohio. The initial diagnosis of you and your sissy at that point was mainly twin-twin, and the laser surgery that they performed was supposed to really calm all of the issues with you two in my womb. The surgery was not successful, and they were only able to drain fluid from Autumn, who at the time was the main baby who was at risk for passing away due to the obsessive amount of fluid you had. Bruna was alright with the fluid she had, so she just wasn't receiving enough blood flow, which the doctor's concern was brain damage from the lack of blood flow. With the surgery not being done how they had hoped, our next journey was seeing how you two was going to respond to surgery with me having contractions. That's what hospitalized me. Aside from recovering from that laser surgery, when I tell you two that I hate being hospitalized, I truly mean that. They ran countless tests and ran different IVs and had multiple ultrasounds just within nearly a week span. And even though you two are sick, you still kept proving the doctors that they were wrong about you two. It was at least 2 to 3 days after that my doctors found that Bruna was very anemic and was passing away. That led to me having to have another surgery, but for Bruna. They believed that a blood transfusion would help with Bruna's anemia. I didn't really want to have another surgery. I felt like there was going to always be another obstacle for you two to overcome with or without surgery. Alright, yeah. I'm just basically talking about the blood transfusion. But a couple things before I wrap this up, because this is pretty long and I did not want it to be this long. But I know that this probably was the weirdest YouTube video you came across because of how fast I talk. But I'm trying here. I really want to kick this off with a good start and hopefully get somewhere. It's really hard to talk about their pregnancy journey with everything that has happened, and how things are going now, even though that they are home and they're doing so much better. Bruna had lung problems, BPD, and all that stuff, but luckily that is under control and we can move on from there. They need physical therapy, they have speech therapy, they have pulmonology, GI, pretty sure that's going to be all of it up until they're like a year old. They do have developmental services for the possible brain damage that either baby could have. There's a high chance that one of them or both could have difficulty learning, walking, but we're gonna go one day at a time. But that is it for today. I don't know when I want to post again. I'm probably gonna self-reflect and calm my nerves for this so I can properly talk to you guys about what is going on in my life and their life. I will talk about the girls personally and more in depth in the next video. Show what they like, dislike, their favorite activities, things that they hate, what they eat, how much they eat, their medicine routine. I don't know if I will do morning and night routines because it really just varies on the day and how their night and morning goes. But if I do find the time to do that, I will try my hardest because I'm not sure I'm going to edit. I'll figure that out too. But that's pretty much it for now. Like, subscribe, laugh with me if you want, because I know that this is pretty new to me, but I'll get there.